of your attendance, that would be great. Well, welcome. My name is Anna Teeter. I am a program manager here, and as is Allison. In the future, it will be Allison handling all the healthcare things, but for today, we're both going to be going through all this information. We're going to actually start out talking about financial assistance, and April's going to help us with those pieces. Then basically we're going to go program by program, talk a little bit about it, what you can expect out of the profession, as well as what you can expect from the class. And then we'll finish up with questions. If you do have personal questions, we ask that you hold it till we turn the recording off, even those who are joining us online, so that we won't have that recorded information for everyone to see in the future. So, April, would you like to share a little bit about how Fast Forward works?
Okay, so Fast Forward is basically like a grant from the state of Virginia that helps Virginia residents gain credentials through us. And sorry. As I was saying, Fast Forward is basically a grant from the state of Virginia that helps provide 2/3 of the cost of the tuition. It helps cover that, and you don't have to pay that back. So, I mean, stipulations are you have to be a Virginia resident for more than a year, and you have to make sure you come to class. There is an attendance policy, and if you're an unsuccessful completer, meaning you fail the class because of attendance, or you don't take the exam at the end of the class, you'll be required to pay 1/3 of that back. And then we also have financial assistance available to those who are income qualified. A family of 4 can make up to $124,800 and still qualify for a class basically for free.
So we gave you a quick fact sheet. If you are not with us presently in the classroom, if you go to laurelridgeworkforce.com, if you look at the ribbons across the top of the screen, you'll see all funding and policies. Under there is the same information. You will see on the back side the program called Fantic, what those numbers are as far as income is concerned. Fantic can help with all the needs-based pieces. So if your income is less than what's on this chart, basically the program could be for free. And that covers all of the costs and expenses. It does follow the same scenarios that April was talking about, in that you would sign a promissory note for that second, third, saying that you would complete the class and sit for the credential. So even if that first part is covered, you still have to sign that promissory note then for the second part. I like to talk about the funding pieces right away in the beginning, because we have so many funding options that don't let money be in the way of you actually moving forward. We also have scholarships available. There's all kinds of things. So if you feel like this is something you really want to pursue, I would definitely say talk to one of our registration team members. Let's talk you through it. Let's figure out if there's a way that we can get you some assistance, so that it's not a barrier in your way. So again, you can look up more information about Fast Forward and Fantic online, or this will give you all the quick highlights regarding that. Okay, so from there, one of the next things that I like to talk about is our catalog as well. So if you're online, you can also look at that under the courses and classes along that ribbon at the top as well. You can click on that and it says view the course catalog. So you can click on it that way. And we're kind of going to be talking about pages 9 through 11. And we're pretty much going to go sort of in order of what's listed in here. So the next slide, please. So the next thing I love to talk about is where are the jobs? Because we want you to know that by taking these programs, there are jobs out there that are directly linked to it. And I also want you to see what the median salary range for those things are. It's also in the catalog as well. At the end of the day, we want you to make a good decision about your future, your career, and what that looks like. So we like to provide that information right at the very beginning. I did pull all of the ones that we're going to talk about tonight. These are just for, I pulled them June 7th, for the last 6 months, and that's just within the Laurel Ridge region. So if you live in Martinsburg, West Virginia, this is not included on this one. This is just Frederick, Winchester, Clark, Shenandoah, Fauquier, and Luray, Page Luray. So it's just within that region. So you can kind of see, obviously, nurse aid or nursing assistants or nurse aides have the most need at this point. There are 412 active jobs, and the median range for that falls around 42,000. And you can see all the other ones listed here as well. I'm not going to go huge into detail with them, but just know part of our job is to make sure that there's jobs on the other side of it. We don't guarantee a job, but we prepare you so that you can go get that job. At the end of the day, I can't do the interview for you. You're gonna have to do it and actually secure that job, but just know they are available out there. So the next slide actually shows the same thing, but it adds surrounding counties. So if you live in Winchester and you don't mind a drive up to Martinsburg or up to Hagerstown, which really is only like 30-45 minutes away, I want you to see that there are a lot of options even outside our region. Same thing if you're over in our Fauquier area or Culpeper, if you're headed towards Gainesville or Gainesville, and closer into DC, there's even more opportunities. Same thing with the Luray Page area, Charlottesville, headed that way, or to Hagerstown. There's a ton of opportunities all throughout our region. When I ran it this way and I pulled those leads, medical secretaries, which is kind of our PSR program, which we're going to talk about, that came to the top. And there were over 819 jobs in that area. The median range being around 36,000 for that. So all that to say is there's a lot of great jobs out there in these fields. So there's a ton of opportunity. So the first one we're going to talk about is the nurse aid program. And if you're looking in the catalog, that one is kind of on page 11 near the end. So as a nurse aid, you primarily work under the supervision of an LPN or an RN at all times. It is an entry-level positions. Many students start out as a CNA. Then they continue on that path to an LPN, an RN. Some students get into it and love this field. So there's a lot of different career opportunities within it. With this one, please know that you do have to register early for it. There is a background check required and a drug screen, physical with immunizations, and a BLS CPR certification is required. And that's because clinicals are a part of the class. So in order to go out to those clinical spaces, they need to make sure that you have that already taken care of. So, slide. At the end of it, you will have the ability to take an exam, which would allow you to become a certified nursing assistant. A lot of times nurse aides are found in assisted living facilities, home health agencies, and also in some areas of the hospital. There's such a need for nurse aides that you can literally pick wherever you want to work, essentially. If you like the idea of cardiology and you want to get your foot in the door, apply for a CNA position working on that wing. It's a great opportunity to rub elbows with those nurses, with those doctors, and get a sense of what it's like to be on a cardiology unit. So there's a ton of opportunities within this field. Just know as well, some of the duties that are included within that could be bathing. It is taking care of basic needs of an individual. It could be getting vital signs, feeding, incontinence care, and monitoring intake and output. Registration for this program is just slightly different than every other program that we'll talk about today. This is a credit-based program, so you would have to apply to the regular college admissions. There is more information both in the catalog about where you would apply as well as on the screen. You would just go to laurelridge.edu/nurseaid, and that gives you, again, more information about that. Okay. Next slide, I'm going to introduce Janet Mays. She is our lead allied health instructor. She teaches these next two classes, medical assisting and phlebotomy. So I'm gonna let her talk about them.
Thanks everyone for joining us this evening. We really appreciate your time and your interest in our programs. So the first program we're going to talk about is medical assisting. This class is it's pretty busy depending on which campus you take it and whether or not there are any Saturdays involved. This class is around 17 to 20 weeks, depending on if it falls over Christmas, different things like that. Again, depending on which campus you take your course at, you may meet twice a week or even 3 times a week. Again, please check out our website for the full schedule of all of our classes. It is imperative that you have regular, reliable internet access for this class. As your homework components, as well as any potential Zoom classes, will be using the internet. The total program is 160 hours. So where will you find a job? Medical assistants, they're primarily employed in doctor's offices, specialty clinics like OBGYN or neurology, urgent care centers, or even with insurance billing companies. There's a wide variety of fields out there. If you have something that sparks your interest, you could work in cardiology, which is the heart, orthopedics, so bones, joints, potential fractures, OBGYN, which is women's health, and women's healthy pregnancies, neurology, the study of the brain and the nervous system, oncology for cancer care, family practice offices, and many, many more. You usually are able to enjoy a set schedule with primarily daylight hours. There's not usually holidays or weekends unless you work in an urgent care center. Those tend to be more 12-hour shifts, which may suit your needs even better. So in the class, we train you on all of these skills and some others that aren't listed here. You learn how to draw blood, administer injections, schedule appointments for patients, even help them schedule for a telehealth visit. So if your doctor uses any type of Zoom or video conferencing visits, you may be responsible for dispensing medications that are administered in the office, phone in prescriptions or prepare them in the electronic health record for the provider, remove stitches, remove staples, things like that, obtain vital signs, learn how to obtain an accurate patient medical history, how to work in the front office, so scheduling patients for the appointment, checking them in, checking them out, reviewing their after visit instructions, things like that. We do practice a lot of skills. Again, things like drawing blood, those type of things are done on each other during class. Participation in the skills is mandatory, not only to ensure your success, but as a part of the course requirement. But we do want you to be successful in the working world. Next, we're going to talk about phlebotomy. So phlebotomy is the study of primarily blood collection, but there is non-blood collection in a phlebotomist role as well. Things like urine specimens, throat cultures, and some others. This class prepares you for this career. We focus primarily on venipuncture, so drawing blood generally from the elbow or the back of the hand, and capillary sticks, which is a finger puncture. Certainly, if it was an infant, it would be a heel stick, but we don't have that in our classroom. So there are some things we simply have to discuss and educate ourselves through some videos. This class is very condensed. It is a 55-hour program. It is intense. We cover a lot of material as well as your skills that are done, the venipunctures, the capillary sticks, learning how to collect the urine specimens, throat cultures, things like that. These skills, in addition, are practiced on each other during class time. Participation is mandatory for our program, and it will help you to become successful in the role of phlebotomy. So where are phlebotomists employed? Oftentimes in the hospital, primarily hospital in the lab setting, donation centers, so things like the Red Cross or plasma donation centers, in doctor's offices, with insurance companies, home health agencies, skilled nursing facilities, even assisted living facilities. You're able to have a quite flexible schedule, which may meet the needs for yourself or your family, depending on where you would like to be employed. So if you're working in a doctor's office, you're going to have kind of that Monday through Friday, 9 to 5. However, if you need to adjust your schedule to be able to maybe take other classes or get your children on and off the bus, you might work in the hospital lab where you go in at 3:30, 4 o'clock in the morning, and you're off much earlier in the day. So it offers a lot of flexibility in your life. This class also requires the use of regular internet, as computer skills are a part of this class as well. If anyone has any questions, I'll be available at the end of the meeting to try to answer any more specifics on that as well.
Hi, so I'm going to talk about the Patient Service Representative Program. This program allows you to sit for a certification, which we'll talk about, I guess, in the next slide. But this training prepares you to work in a front office. So that's the person who greets you and when you come in and checks you in, they'll often are called different things. So you'll have patient service representative or medical office assistant. So all these different things like unit secretary, admissions coordinator, all these things are names that are used for patient service representatives. So when you're looking for jobs and things like that, when you probably want to put in healthcare or something like that, so all these will pop up.
We just call it that because one of the bigger employers here call it that. So if you're looking up just patient service representative, you might not find a ton of jobs in it. But again, if you just put medical or healthcare in there, it'll give you a whole bunch of different things and you can kind of sort through just because everybody has a different name for it. And that's true actually in a lot of the areas of healthcare, not just this specific program, but this one is really highlighted because there's as you can see, a ton of different names for it.
So yeah, this job, you'll be scheduling appointments, you'll work on electronic medical or health records. So you'll learn how to do that. You greet patients, you file for insurance, you may help with banking or coding procedures in the back office as well. So this class also has a big part of medical terminology in there. So when you're scheduling appointments and stuff like that, you need to understand what you're scheduling. And so the medical terminology is a really important part of the program. So you'll be doing that as well. There'll be practice on a electronic health record. So it's called EHR Go, and you'll log in and practice doing that before you finish the class, so you can have a familiarity with it when you go into the office setting. This is a live online class, so it's done virtually, 100% virtually. It says face-to-face there, but it's not doing, you're not doing that this fall, right?
Yeah, not this fall.
So it's live online, so it's all done remotely. You'll have lectures and support from an instructor remotely. The class is 60 hours and you can sit for the certified medical administrative assistant through the National Health Careers Association at the end of it.
One more little thing I'm going to interject in this one. If you really want to work in healthcare, but you're not interested in any of the clinical parts, so you're not interested in being that hands-on, but you really want to be a part of someone's healthcare journey, this is an awesome opportunity for those of you who may not want to deal with blood or some of the other types of things that are out there.
Great point. So the next one we have is our dental assisting program. This is very similar to that medical assisting side, except for it's in the dental world. So you work right alongside the dentist, and we practice something called 4-unit dentistry. And basically, as an assistant, you're 2 of those hands. The dentist is the other 2 hands. So as they're going through procedures, you're handing the instrumentation. and you work back and forth sometimes, obviously, hopefully, we've all been to the dentist at some point when they say suction. The dentist, the dental assistant is doing those things. It is very funny, it seems like those who are interested in medical assisting have no interest in teeth at all. But the same is also true, those who work in the dental world, they have no interest in people's feet or any of those things. So you definitely want to be interested in working in someone else's mouth, in this role, but they are a huge and valuable member of the dental care team. They can also do front office as far as checking people in, those types of things, but they can also do that clinical side as well, doing the room setup very similarly to medical assistants. They will clean the instrumentation afterwards, sterilize them, and those kinds of things. So in this class, you'll be trained in both that front end and the back end. Again, we just kind of talked about some of the things that are included that they would do. Really, they're just assisting that dentist with whatever is needed. The cool thing about this class is that we do, like medical assisting, cover so many different areas that you could potentially work in. So like as Janet has said, if you want to work in family practice, you can do that as a medical assistant, or you could go into peds or any of those little specialties. Whereas dental assistants can do the same thing. There's surgery, and it never fails. Whenever I go to observe this class, I end up on extraction night. And so that is clearly not my thing. And it was very funny. One of the last times I sat in, the student that was sitting in front of me, she's like, "This is why I'm not doing surgery." She wants to go into ortho. But the cool thing about these classes is you get it by going through all of these different things. You get to get a sense of like what you're interested in and what areas then you want to apply to. So in the dental world, you could do pediatrics, you could do orthodontics, which is what that student wanted to do. And then there's also family practice, which can cover a whole host of different things. So I will mention, though, I did not mention it on the slide, but this is one of the only classes I think that we're going to talk about today that is not a fast forward class. So that one is a full price class. And the reason to that is simply because we have to tie a credential to it. At this point, the employers in the area aren't necessarily looking for a credential. They want to know that you have the skills. They want to know that you know what instrumentation is when they need to say, "Hey, I want this," or "I need this," or they want to know that you can sterilize things. So at this point, just sort of as red tape, I don't have a credential to tie it to. But it is a very viable career. There's great opportunities in it. Again, if funding is an issue though, talk to our team, our ops team, and we can talk about, there could be potential other scholarships or other things. There's sometimes outside organizations that can help with it as well. So if that's really something you want to pursue, talk to our team and we'll go from there. So next we're going to talk about pharmacy tech, and we're super excited about this one.
So the pharmacy tech program is going to be restarted. We stopped it for a while and are restarting it again, hopefully in August. So the pharmacy techs prepare medication under the guidance of a pharmacist. You can work in a lot of different settings. You can work in a hospital setting. You can work in like a CVS or a private pharmacy, and there's a lot of different opportunities to do different types of things within the pharmacy tech world as well.
And the reason why I would pause it is there's actually legislation that changed, and it now requires it to be an accredited program. So with that, it changed our total number of hours and all of those pieces. And you'll see what all is included with that accreditation as we kind of talk a little bit more about this.
Right. So you learn how to prepare and distribute medications. You can do it in a nursing home, you can do it in a hospital setting, and you can do it in a retail pharmacy kind of setting. It's very heavy in math, so you do need to perform calculations. So there is an assessment that you'll need to take prior to registering for class to see where your math skills are. You can take that several times, I think three times. Hopefully you'll pass within that time. And if not, we can talk to you about some sort of remediation to kind of get you up to speed. So maybe that you'd be ready to take it the next time.
And when we talk about heavy math, we're saying really you need to know fractions, percents and whole numbers. So it's not like we need trigonometry or
It's al-
anything like that.
it's
basic
algebra. It's algebra. But a lot of people haven't had algebra in a really
Yes.
long time, so you might need to freshen up with that. So in a retail setting, you'll also work at the register and do those sorts of transactions, as well as collecting information, maybe taking prescriptions off the from doctor's offices and things like that. Else. So this program is now, it's required to be at least 400 hours. Our program is going to be around 411 hours. It'll take about 18 weeks. You'll start off doing didactic work, which is just your book work. And that'll be online. So you'll have a login, you'll go in and you'll do the work, and then you'll come in once a week and do simulations with the instructor.
We're building a fun little lab upstairs,
It's
in this building.
yes,
so-
it's in the process. It's getting put together, and we're really excited to see changes every day in it. So it'll be really nice when you come. So it'll simulate a retail pharmacy setting. So go in and it look just like a CVS or a private pharmacy office. So you'll do those simulations. You're required to do the simulations before you can go into a clinical site. So there's experiential learning portion, which is going to be over about 220 hours, is that right? That you will do. So once you're done with the didactic part, you'll start the experiential learning. So we'll place you in a pharmacy, local pharmacy, to get that experience, and you'll be paired up with a preceptor there, and you'll learn real life skills. You'll take what you learned in class and do them in the pharmacy setting.
The biggest thing that we probably want you to know is this is a part-time job. When you think about 25 hours a week that you need to be prepared to put into this, that's a part-time job. So it is pretty intensive. There's gonna be a lot to it, whether it's online, in the classroom, the simulations, or out at a pharmacy. There's a lot. It's gonna be a fantastic program. But just be prepared for that level of intensity.
Yeah, even when you're not in a clinical setting or at the pharmacy, there's going to be about 25 hours worth of work per week that you'll need to do, or come into the college to do. So there are some prerequisites for this class. You have to be 18 years old to take this class and have a high school diploma or GED. You need to have regular and reliable internet access and a computer, because a good portion of it's online. And you'll need to have transportation both to come to the college for that simulation part, but also to travel to the clinical site. We try to get clinical sites, within a certain radius of the college, but you may have to travel a little bit to get to that site. So before registration, just like I said, you're gonna have to take a math and reading proficiency assessment. And that is required by the accrediting body for us to do. So like we said before, you can take it more than once. And we'll follow up with you about that. Oh, yes. So once you register, you'll get a link to go on to Canvas to start your paperwork for the clinical setting. So you're going to have a background check, a drug screen, a physical with all up-to-date immunizations. And this needs to be done by the first day of class. Because you have a clinical component to your class, it is required to have this done. So if you don't have it done by clinical, you would fail. So we wouldn't want you to start the class if you don't have that done. So start on that right away. As soon as you register, go to that and start on that right away. Make sure you have all that paperwork done so that you can start the class. So there's additional costs to consider with some of the programs, including that background check and drug screen. That is out-of-pocket expenses. It's not covered in tuition. their physical immunizations that can vary in cost, whether you're up to date or not. If you are, then it won't cost as much. And if you do need some things, it'll cost a little bit more. You will need to purchase scrubs, to go to clinical. Do you need them in the classroom too? I wasn't sure about that.
So probably for their simulation day, yes,
Okay.
because it's gonna be just like you were going to work.
Okay. And transportation costs, and there is a registration to the Board of Pharmacy, so it's $25, I think. So in order to go into the clinical site, you have to be an apprentice, I forget what the term is, but it's sort of apprentice pharmacy tech, and you need to apply for that in order to go. So that's $25 to do that. So those are all out-of-pocket expenses for this.
So before I go on, I forgot one other thing that, as we were talking about the excitement of pharmacy starting up here in Middletown next month, or August, feels like next month already, but in August, we also have our dental assisting is actually gonna be offered for the first time out in Falk here as well. So if anyone lives closer to that area and is interested in the dental assisting program there, we have a partnership with the free clinic out there, and that's where we're gonna be doing our clinicals. So just know that that's another great possibility. It's the first time that we're offering it, and we're super excited about that. We also offer BLS CPR classes. Those are listed in the catalog. First, we don't require it for all of our classes. The only one that it's included with is dental assisting. Because that is a requirement on almost every job application that you're gonna fill out. So that is a requirement. For all of our other classes, it's optional. So if that's something that you wanna have, before you apply somewhere, we certainly have that opportunity. Some employers, and the reason why we don't include it, is some employers, when you get hired there, they'll do their own CPR training. So it's really up to you whether you wanna have it in advance or not, with the exception of like nurse aid, because we're doing clinicals there, or dental assisting, because we know that that's just a huge part of it. And we also have a bunch of other online courses that you can find through just that laurelridgeworkforce.com. So there is no way we could cover all of the detailed information about all of these classes in this session. We have awesome student handbooks available to you. That link, if you look at page number 9 down here in the corner, there's a link to all of our student handbooks. There are videos on that site from some of our instructors, so you can hear a little bit more about it from them. I encourage you, before you register, or if you have already registered, go and read those handbooks. That's what we are saying we're going to expect from you in this class, but it's also what you can expect from us in that class. So I encourage you to read through that, make sure you understand it. On the first day of your classes, you will sign that you read it and understand it, and we will go through it word for word, but we want you to make sure you have that in advance. And it'll cover a lot more detailed information as well. We also have classes on just our workforce.edu site. Like we've mentioned, you have to have internet access. If that scares you and you're like, I don't even know what the word Canvas is or what Zoom is or any of those things, we've got some free little classes that you can take to help you get those skills or get that technology. So those are available on our website. Almost all of the classes you've heard us say require computer and internet, just because that's where a lot of our homework is done. And ultimately, our job with all of this is to prepare you for the workforce. So in almost all of these professions, you're gonna have to work in an EMR system, an electronic health record system. So you're gonna have to know how to type, you're gonna have to know how to toggle between screens and all those things. So we incorporate a lot of those things into our classes because we want you to be prepared and successful. We do use Canvas as a platform. It's just a learning management tool that has, our teachers can post announcements. We get email through those things. They can post their videos and lectures or just all the homework assignments. So just to conclude, we're super thankful that you joined us today. If you are online, if you didn't put your name in the chat, if you would, April's kind of monitoring that and checking that. If you've got questions, you can certainly ask her there. We have a great operations team. We can talk through financial aid with you. If you've got more questions, we're available as well. In the back of this catalog, Right here are all our little, what we like to call mug shots. So you can see my information there. Allison's not there yet, but she'll be in the next one. But you can feel free to reach out to any of us. Janet is there as well. So if you're like, hey, I have a question about medical assistant, I'm not sure if it's for me, you can also reach out to her. We also have a career coach. Her name is Lisa Heiser. If you're just like, hey, I'm not really sure what I want to do and you want to talk through someone or talk to someone about all of those things, you can certainly reach out to Lisa as well. You can shoot her an email. There's a ton of information on our website. And thank you. So if you want to stop the recording.